Good afternoon. My name is Abraham Segrist with the Virginia Hospital and Healthcare Association and would like to welcome you to our webinar this afternoon. I will cover a couple of housekeeping notes and then turn over to one of our main presenters, Jennifer Kreiser, the Chief Nursing Officer at Centera Lee Hospital in Norfolk, Virginia, and also the chair of our VHHA Patient and Family Experience Forum. Following the webinar this afternoon, we will provide a copy of all the slides, a recording, and a copy of other material that will be referenced during this afternoon's webinar. Additionally, at a portion of our webinar this afternoon, you, the attendees, will be asked to provide some feedback by using either the question or the chat feature that is in your control panel. So in order to do that, we would like to request that you take a couple of minutes and enter the name of your hospital into that chat feature so you're familiar with it. Without further ado, it is now my pleasure to introduce Jennifer Kreiser, Chief Nursing Officer at Centera Lee Hospital in Norfolk, Virginia. Jennifer, the floor is yours.
Great, thank you. And good afternoon and welcome to the 2022-2023 VHHA Next Level Patient Experience Kickoff Webinar. Brenda Woodcox and I chair the Patient and Family Experience Forum, which has been guiding the VHHA in developing this initiative. Last May, our forum approved the Next Level Patient Experience Work Plan. This work plan had two components. The first part of the plan called for conducting a series of surveys of both hospital leaders and patients. This allowed us to get a sense of current needs and perspectives on patient experience in Virginia hospitals, including perspectives in the aftermath of COVID-19 pandemic. The surveys were completed this summer, and you'll hear an overview of those results today. The second part of our plan called for us to use the survey results to develop a statewide education plan to support hospital leaders and their patient experience improvement efforts. The release today of the VHHA Next Level Patient Experience Communication Playbook is the first resource created under this educational plan. So at this time, I'd like to turn the meeting over to Julian Walker, VHHA's Vice President of Communications, who will present the results of the statewide patient poll. Afterwards, after Julian, Carrie Brady O'Neill, who's been working with the VHHA team on this initiative, will share the results from the member survey and introduce our communication playbook.
Well, good morning, good afternoon. I'm pleased to be here. I will briefly share with you some results from public opinion research that VHHA conducts. Just for your background, VHHA does regular and ongoing public opinion survey research because we want to keep our finger on the pulse of what's going on in terms of how people perceive hospitals, how people perceive healthcare issues, because it helps us understand both the strengths and perceptions about the healthcare community, as well as potential vulnerabilities. And so we do this on a number of quality issues, but also on things related to public policy advocacy issues that we know will be coming up in future legislative sessions, because we want to know, again, how the public sees the issues that are impacting us and sees the issue and our members, and also sees the issues that we will be engaged on from a public policy advocacy or lobbying perspective. As a component of these surveys tend to be in the range of about 50 questions. As I said, we do them several times a year. There is variation from one survey to the next, but we will often infuse in those surveys, as I mentioned, some things related to upcoming or present issues of concern that are in the public realm as it relates to healthcare. And then there are questions I would say are carryover or repeat questions, and we do those for baselining purposes. So if we ask, for example, hospital perceptions, which we do in every survey, we want to be able to track that over a data trend line over years, so we have a sense of, where the numbers are moving. Are they trending in a positive direction? Are they declining? And if so, what strategies or steps do we need to take in response to that information? So if we can go to the next slide, please. Next one after that, please. So one of the things that we ask is just about one, and this is for baseline purposes, have you or a family member been admitted to a hospital or gone to the emergency department in the past year? And as you see, these numbers are pretty consistent. For 2022, it was 53% of those polled said that they had had a personal or family experience in a hospital emergency department in the previous year. That number, again, for baselining purposes, if you look at 2021, pretty consistent, 52%, 48%. And then in the fine print, if you see at the bottom of the slide, in 2020, that was 54-46 split. And then 2019, there was a deviation in those numbers, 62%. So a higher percentage of those polled had a personal experience with the hospital or emergency department. I will say just quickly, just for an understanding of polling methodology, when you conduct a poll, and I did not say this in the intro, but we do a sample size that is representative of the unique demographics of the Commonwealth of Virginia. So we make sure that our sample includes, a representative number of men and women and African Americans and white folks and Asian folks and Latino folks that is representative demographically of the population. And the same thing for political affiliation. We make sure that looking at voting numbers, our survey sample reflects the number of Republicans and Democrats and independents in the state. And so one thing I will just say quickly about polling methodology as we look at this slide is when you do a poll, you have what's known as a statistical margin of error. And so for this poll, the statistical margin of error is about 3.5%. And so what that means is that for any number that you see here, statistically speaking, the deviation could be 3% one way or the other. So when we see numbers that are for 2022, 47-53 split, or for 2021, 52-48 split, those are functionally equivalent numbers when you factor in that 3.5% margin of error. Next slide, please. So we also asked about overall experience, personal experience with a hospital. This scale is on, the response options are very positive, somewhat negative, very negative, and no response. This is what's known, again, just for polling parlance, this is what's known as a Likert scale in a poll. And the numbers here are overwhelmingly positive. 83% indicate of those polled they had a positive experience in hospitals, compared with just 14% who said they had a negative experience. And then again, if you look at the fine print on this slide, what we see is that those numbers are pretty consistent year over year. 78% positive, 83% positive, 87% positive. So again, going back to that margin of error note that I just made, when you look at that in relation, 83, you drop it down, 3.5%, you're right around 80%. So that's right in line with that 78%. Same thing with 83 the previous year. So again, these numbers are holding firm and are consistent, which is a good sign. Next slide, please. Also, what we want to do is for those who indicated in our poll that they had a negative experience, this is a subset of the total number of those individuals polled. So this is not everybody polled. This is just those who selected that their response was negative, which again was 14%. So a much smaller subset. We did want to ask them, what is the reason that you responded in the negative to this question, to the previous question? And so what we found, we gave them a range of options. And what we found is 35% indicated that their perception of uncaring or inattentive staff was the reason that they cited for having a negative experience. 30% cited the cost of hospital care, 13% because of an out-of-network issue, 12% because of a claim denial, so those two are both payer related, and then 9% due to difficulty during the admission process. So these responses give us some indication potentially of places where it is possible to evaluate hospital processes and see if there are ways to improve some of those things in terms of, staff attentiveness or staff interaction with patients, as well as things like the admission process. I would also point out again, just for edification on the polling process, on questions like these where there are multiple options, what we do to make sure that we are being as statistically sound as possible is we rotate the order of the survey responses, the response options to the question. In other words, if I got the question, if I got polled and got this question and Carrie got this question, the order in which we both were presented the response options would be different. And that's an intentional statistical tool to ensure that we are not in any way, even unintentionally, putting our thumb on the scale, because there is a statistical bit of research that suggests that if you ask everybody the question with the order options or the answer options all in the same order, you're going to get a slight deviation that favors that first response option. So we always rotate the order in which people get the response options so that we don't introduce any sort of statistical noise into this survey. Next slide, please. And then we also wanted to ask, when you were a family member or hospitalized, what is most important to you? And again, you can see some correlation between the responses here and the response to the previous question. So again, the highest number here, 37%, is clear patient communication. In the previous question, 35% who said they had a negative experience said that it was uncaring or inattentive staff. So we can see a bit of a connection there. 23% said that kind and caring staff, which again correlates to that response in the previous question, was what they value most when they're hospitalized. 17% said patient safety in a hospital, 13% said keeping the patient or their family informed, and then 10% said they wanted clear discharge instructions when they are being discharged from the hospital. So those are my slides and my portion of this presentation. So thank you for your time.
Thank you, Julian. That's incredibly helpful. As we put together this program, we wanted to make sure that we actually took a snapshot now of what patients were thinking, what family members were thinking, and of course, what members were thinking about current challenges. One of the interesting things about the polling results that Julian just described was that when we asked the question on the flip side, what patients are most concerned about, they responded in the same way. It's inadequate communication and it's uncaring or overwhelmed staff. So, and these answers were consistent as we drilled into this with really well-designed polling that Julian did across the Commonwealth, across gender, across race, across political affiliation, and so on. So we know we really have a sense of what patients are looking for right now from us as hospitals and what they're concerned about. So as we develop this next level patient experience, what does next level mean? We wanted to explain a little bit. This is really about going back to basics and aligning foundations, because what COVID did was really like in a Jenga puzzle. We had some pieces pulled out and things twisted around, but unlike in a Jenga puzzle, we have an opportunity to put those pieces back together again in a way that's going to be effective. So we want to re-engage patients, families, communities, and staff, promote a common understanding of what is expected. That certainly shifted during COVID in terms of who could be present with a patient, how you're going to communicate. That was a huge shift. And of course, masking. So how do we reinvent in light of COVID, rebuild these relationships, and then get back on really solid ground and common understandings with patients and staff and the community? So there are 4 aspects to the plan. You just heard about one of them, which is our patient and family engagement, to survey for aspects of an ideal patient experience and what patients are concerned about. We also did the statewide assessment of hospitals so that we asked what they needed now, and I'm going to share those results with you in just a minute. And what we wanted to do with all of this information, as Jennifer referenced, is to create these COVID-informed, really timely and actionable educational resources. And we know, by the way, so before you start to worry that this is a big new initiative and you do not have the bandwidth for it, we know that. So these are supposed to be very simple tools, simple resources, things that you could implement with very limited time and energy, and just focus on where it makes sense aligned with your current information so that you can gather some additional information and make small changes based on it. How do you use your existing things? So this isn't some brand new thing that you have to worry about. And of course, the playbooks are purely optional whether or not you implement any of these plays. We've also, you probably have seen the newsletter about the VHHA data dashboard has been updated again now that we have a full year of HCAHPS data being published again by CMS. So the dashboard will be updated quarterly, and we'll be combining all of this information into an updated patient and family experience improvement guide ultimately. The statewide member survey, we did 3 member surveys, nursing leaders, physician leaders, and patient experience leaders, and we had 50 responses. And one of the things that was really interesting was how closely the members' concerns were aligned with what the patients were saying. So the member priorities and concerns were related to communication, various forms of communication. There was a lot of discussion about rounding, getting back to rounding, also bedside shift reporting, all of these sorts of things, other methods of communication, and how do you engage staff now? How do you address staff burnout? How do you re-inspire your staff? Which again, the flip side of that is when patients are saying that they're worried about uncaring or overwhelmed staff, it is because the staff's overwhelmed. They're not uncaring, but they've been through a lot. So how can we, as healthcare organizations, re-engage the teams in a way that's going to be valuable, playful, and not continue burnout? One of the surprising things that we found in terms of the surveys, we did not expect this result. We asked how people felt the relationship had changed between patients and staff since before the onset of the pandemic to date. And what we found was that although slightly less than half of the people responded that the relationship had deteriorated, a third said it is the same, and nearly a quarter said it had actually improved. So we dug into that a little bit because that was fascinating as the data came in. The negative impacts on the relationship, I'm sure everyone can say off the top of their head. Of course, communication has deteriorated. There's a lot of discussion in the feedback and that we got on the surveys about incivility, about distrust, about creating an adversarial relationship, often discussed in the context of the clinical team had to become kind of the police of masking and who could be with the patient and things like that, which did change the relationship. And one of the comments that we got on the survey summed it up really nicely, saying, families and patients are more demanding and they're quicker to anger and less coping mechanisms, and staff are stressed, less tolerant, and have less coping mechanisms. Obviously, not an ideal situation when both sides of the equation are incredibly stressed. And yet, despite these challenges, and there have been many in healthcare, and there were many before COVID, but certainly more since COVID, despite all these challenges, there were some organizations that said the relationship actually improved. Here are some of the things that organizations identified in the poll as being their most successful post-COVID, and by post-COVID, I mean post the onset of COVID, initiatives that they did. So technology to facilitate communication was mentioned many times, and there's many different ways of doing this. These are just a few of the things that people said. One organization mentioned that they created special badges where you could actually see the smiling face of every staff member so that patients could actually imagine who was behind that mask, because of course, so much of the way that we as humans receive information is that nonverbal communication. So when you take out facial expressions and just see the eyes, it does make it harder sometimes. It's sort of like texting, and we all know in texting, context gets lost. So we're not texting, but we are losing part of the communication. So how do we try to get that back? Discharge phone calls were mentioned, rounding. The number of times that rounding was mentioned as a strategy to improve the relationship and to rebuild that relationship, it came up over and over and over again, and both in the context of what was most successful and in the context of what members said their priorities were for the upcoming year, wanting to get back to more rounding more effectively, and so on, because some organizations intensified that over the last 2 years, and some organizations redirected resources and energy in other areas and therefore less rounding, and I want to get back to it. There was also some discussion about broadening the care team and how do you engage non-clinical staff in providing support at the bedside, obviously in a non-clinical manner, particularly when you have patients who may not have as much access to their support system. So how do you include non-clinical staff also in supporting your clinical teams in ways that they can when there are either staffing issues or other things. So there was some cross-training being done there. Some organizations talked about creating special ways to support their staff, so an employee quiet room, refreshment carts, things like this, recognizing that your team needs a boost, and how do you improve morale and make sure you're providing some comfort to them on an ongoing basis. And then these last couple are really about process improvement and talking about rapid cycle change and recognizing this is rapid cycle change, because with the onset of COVID, there have been many shifts. There will continue to be shifts. And so it's really an opportunity to relook at things, and not necessarily in a very extensive systemic, as I said, this is not new initiative, let's roll something else out. No one has the bandwidth for that right now. Everyone is exhausted and burned out, and instead really just doing these tweaks and course corrections on what is and is not working in your own organization, and just taking a look at that and saying, okay, well, let's try this, and maybe try this thing, this small little shift, and see how it goes. And that responsiveness goes a long way, and frontline staff talk about that a lot, recognizing that changing things that aren't working is just as important as figuring out what does, and saying this didn't work, so we're not going to do it anymore. And then the alignment, not letting the lessons learned go to waste. There are so many wonderful things that you all did during COVID to come together as a team, to align efforts, to deal with the sort of common enemy, so to speak, of COVID. So tapping into those lessons and figuring out, often organizations say that they are at their best in a crisis, whether it's a hurricane or some other environmental factor. They come together, they work really well as a team. And if you can tap into what worked well and how things were adapted during COVID and have that discussion with your team, you'll gain some really valuable information that you can use for any initiatives or any efforts in any area going forward, not just patient experience. One of the great things that we found in the survey, and though we have not asked this question formally in a survey in the past, this would have been different in the past. 76% of the respondents said that patient experience is now perceived by everyone, widespread perception in the organization as integral to quality and safety. And that's huge because for a long time, this has been considered to be a separate thing, not really core to quality and safety. And so attitudes have definitely been shifting about that. We also asked about the 4 foundations that we have been talking about for years as part of our effort at VHHA, and that the research supports are the foundations for patient experience programs that are successful. It's leadership, patient and family engagement, staff engagement, and effective use of your data. So we asked the respondents to tell us what they thought the strength of the foundations were comparatively, and you can see that they were rated from very strong to weak. So the strongest foundation, now this is one of those things where depending on who you ask, if you ask leaders, it is not surprising that leadership will be identified as the strongest foundation, so there's no surprise there. But what's interesting is that where we're seeing the opportunities based on the responses is that data is being used more effectively, but both patient and family engagement and staff engagement were identified as the areas in which members were looking for more support at this time and needing to really shore up those relationships, both with staff and with patient and families. And of course, that is consistent with the other questions, and that's consistent with what Virginia residents were reporting in their poll as well. These next 3 slides, I'm just in here to give you a sense of what people asked for in terms of education. So if you have thoughts about other things that you would like VHHA to offer education related to, please do let VHHA know, because we're going to be continuing to roll out educational tools and resources and webinars and potentially in-person events as well. And we want to make sure we're addressing what's really timely for you. So here you can see what people suggested in terms of leadership, effective use of data, and then for each of patient and family engagement and for your staff engagement as well, lots of suggestions about what you need. But we know that we had 50 people who responded to the survey, and we're very grateful for those 50 people who responded to the survey. But we currently have, according to my little panel here, 75 people on this webinar today, and some of you who will be listening in the future to the replay as well. So we would love to hear from you. Take a look at what people are asking for in terms of education, and if what you think is most important is not already on here, please do add it, because this is an evolving educational plan that we will continue to develop in response to member needs. We also received some recommendations about how to create the education resources. And I think it's really important to emphasize again, and you heard me say it before, that these are not whole new initiatives. These are not time consuming. What we were advised is that we need to engage in playful strategies that get staff to want to do them so that we avoid further burnout, so that we're re-inspiring people in a low-key way that gets them excited, where they want to engage and they want to do the kinds of things. And you're going to see how playful these things are in a few minutes here. Also, members have asked for many opportunities for networking and sharing of innovations, because really you've all been innovating for the last 2 years. You've been doing it at the front line. That is where really valuable information lies, is to tap into the wisdom of your own team, because there are people in your organization who have figured out ways to do things differently. And sometimes you may know about that and sometimes you may not. So part of it is about tapping into not only your own experience in your own organization, but what other organizations in the Commonwealth have learned to do. And there's just so much rich information in this state that we're going to be gathering and sharing. We also were advised to divide materials into small sections so that as leaders, you could take, and you'll see when I start to talk about the playbook, we will be dividing the video into sections. So if you decide to do one of these plays, you'll be able to just take the 5 minutes or less about that play and play that part of the video for your team, so that it makes it easy. You don't have to re-explain it. You can just play the video hand them the page out of the playbook and you have what you need to move forward. And then it was also suggested that we collate all of these resources into an online library so that you may not be running particular plays now, but you may want to do them in the future. You want to refer back to something. So making it available in an online library where you can literally pull down what you need when you need it and then move forward with it should you wish to do so. So we're putting resources together as well and thinking through what kind of resources, in addition to those that VHHA is creating, could also be linked to in there, just as we did in the prior patient and family experience resource guide. We included links to some really great resources that other organizations had collected and were publicly available so that you could have sort of one-stop shopping of some key resources. So now I'm wondering if you guys can use the chat function or the question function, because if you can, what I'm about to do is a really great thing to do with your team. So I'm going to do it and hope that you will participate by entering in chat or questions. The way this is structured, only the presenters can see it, so you're not going to see each other's responses, but hopefully some of you can find that panel. It should be at the bottom or on the right side of your screen, and you can click into chat. And this is something I encourage everybody to do with their team. So this is just a little quiz on communication. And all I want you to do, it's very, very simple, is to read the sentence that is here, not communication quiz, so ignore the header. Read the sentence and count the number of times the letter F appears in the sentence. And then you can put the number in chat or questions. So I'm going to open up both chat and questions and see if you guys can do this. Because, and we'll give you a second, I would be, if we were in person, singing the Jeopardy theme song, but I'm not sure how well that would translate through a webinar. So, and you don't just want to hear me sing. If we were in person, we'd all sing together and then no one could hear my singing voice. But okay, so you've all had a chance to look at the sentence and see how many F's there are. So I'm going to see, okay, good. We're getting some different responses here. So here's the thing. There are, now, be honest with yourself about the number that you thought when I tell you this. There are 11 letter F's in this sentence, all right? Here's where they are. So when you do this with your team, and again, I encourage you to do this with your team, and you can make any sentence you want. But here's the thing. When we learn to read, because we've all learned to read in relatively similar manners, you can ask a 5-year-old this question, or a child just learning to read, they will get every single F because they are still looking at every letter. Once we've actually learned to read and process words and sentences, we skip over the letters that are unimportant and the words that are unimportant. So when you have several F's together, or if you have the word of is not an important word. So that's usually what people miss. The reason that this activity can be so powerful is because it reminds us that no matter how hard we look at something and how much energy and intention and how well motivated we are, we simply cannot see it anymore from a patient perspective because we are insiders. We see it from our perspective. We can empathize and have compassion, but things that are very familiar to us are not familiar to our patients. And so it's really important that we ask them. Also, frontline staff has a different perspective than we do as well as leaders. So it's really important to ask the question, even though the question seems simple, because if we can ask this question, and I guarantee you, if you do it with a room full of staff, you will get different answers and different numbers, and people are shocked to see how easily it is that we have this variability. And you can imagine how much more complicated improving patient experience is than counting the number of F's. So we need all these different perspectives, which is why, as we move now into our communication playbook, you'll see that we have many, many strategies for figuring out what it is that your patients are really looking for from you for communication. So the VHHA Next Level Patient Experience Communication Playbook involves a play, or in one case, 2 plays, for each of the foundational elements of patient experience. These, as I said, are designed to be easy to implement and simple and engaging. So the communication plays, in summary, we have some leader rounding questions related to communication for leadership. We have a request to your patient and family advisors or your other sources of information where you get feedback from patients and families, some questions that you can ask them. Staff engagement, we have 2 very fun things that you can do with your staff that they will love doing. And then we have a strategy so you can mine your own data to find out who your really high performers are in the organization with respect to communication and learn from them, because they're working in the same constraints that everyone else has, but they're knocking it out of the park because the patients are naming them in your surveys or naming them in compliments and so on. So we're going to talk about these different things. The benefits of the plays is that when you ask the patients and you ask your staff and you engage people all together in this way, you create shared expectations. We may think we know what excellent communication means, but often what we're thinking may not be what patients are thinking. And just a quick story, that when I was working with hospital associations and the HCAP survey, there was a hospital that shared this story in a workshop about how they had been trying to improve physician communication, and they were literally driving their physicians crazy because they had tried everything they could think of, going through all sorts of things and changing the way physicians were communicating in the hospital. And their scores were actually going down on physician communication. So everybody was very frustrated. They didn't know what to do. They finally convened a focus group with patients because this was the first time they had really asked the patients. And it turned out that the patients had been thrilled with the communication in the hospital. The problem was the communication was breaking down between the hospitalists and the primary care physicians. Well, technically, HCAPS is asking about your inpatient experience, but it doesn't matter what it's technically asking about because patients are answering it based on what they believe excellent communication to be. And since their primary care doctors didn't have all the information about what had happened in the hospital, that's what they were upset about. That's why they were ranking physician communication low. And once the hospital was able to address that, everything changed. But you can imagine how much time and energy and resources were wasted on trying to change something that was actually working well because they weren't aiming at the right target. So we have to make sure we're aiming at the right target. And the way to do this is to actually talk to everybody involved and find out what is excellent communication, what does it mean? You want to learn from frontline innovation, as I said, and you can re-engage staff by making things playful and also making it safe to talk about when things go wrong, because usually when things go wrong, people are frustrated and upset when things go wrong, but we don't always learn from when things go wrong. So taking kind of a Failfest approach to communication and saying, when do we say the wrong thing? When do we wish we had done it differently? How does this come up and how do we do it differently can be very powerful. The philosophy behind this is rooted in various different academic ways of approaching learning. So I'm just going to touch on a couple of them because they're really powerful. Appreciative inquiry says instead of looking at what's going wrong, we look at what's going well, and then we amplify those strengths and spread them throughout the organization. So it's just a different way of doing this. And if you start talking to your team about, hey, what do we do really well? And when do we do it really well? And then how do we take what we do really well and when we do it and apply it more broadly to other situations and so on. So it's coming at it from a completely different perspective. Positive deviance is where you look at somebody who's doing something differently within your environment. So despite the challenges, you have people that are being highlighted by patients as communicating really well. You want to find out who they are so that you can then shadow them and find out what it is they're doing and then spread that. And then Failfest, you want to learn from failure, encourage innovation, and by sharing this information statewide, you can stop reinventing the wheel. You don't have to do this alone. You can share a lot of information with each other, and do not underestimate the simple things that you're doing, because sometimes people say, oh, this isn't special enough to share with my peers because it's just this little thing that we do. Those little things are incredibly powerful. So you want to share them because it helps everyone try different things, test things out, and really innovate because you're in a new situation. So how to use the playbook. You can select one or more of the strategies in the playbook that makes sense to you. There's only one page per play, so the playbook is very simple and easy to understand. And then if you do implement one of the plays, let VHHA know that you're doing it and share your results so that we can compile statewide information and share that with everybody so we all learn from each other. Now I'm going to go through the plays one by one just to give you an overview of them. So the first is our patient and family engagement play, where you're going to define what are the patient characteristics of effective communication. We know, based on what the polling showed, that communication is really important to patients. It's what they're concerned about, and it's what they say is most important in a hospitalization. So how do you know what that means? So the goal is to identify from your patient population, so this is now specific to your patients, what are the aspects of effective communication, and then to get some examples from your current inpatients of what is excellent communication and what are some things that are impairing communication. And it's a valuable opportunity to do this on rounding, to speak to your own inpatients, because they are in the trenches. They have just experienced this and they know what's going on. So you're going to pick an existing method of getting input. So if you have a patient and family advisory council, it's fantastic to ask them. Some of you reported in the member survey results that you have social media discussions, other kind of community forums. You can use whatever you have, so that we're not asking you to create a new way of communicating with patients and families. You can ask some communication questions and then compile them into some resources about what do our patients say makes communication effective, what makes it not work well, and do we have any suggestions, from your patients for improvement. Then you're going to share that list internally and then share it with VHHA. These are some of the potential questions. There's no magic to these questions specifically. You are welcome to make up your own, but you can see that they're really about how do you define communication, what makes it good, what makes it poor, and then also a specific question here about COVID, because we want to ask patients, they are aware with the masking and the limitations sometime on in-person communication with loved ones. That, although those rules change often and that can create frustration, that has become something that certainly has some expectations around it, that there may be some limitations. So ask your community, do you have any suggestions for how we could do it better with these mandates in place? Because they may have heard about something that was done at another organization, or they just may be really creative people and have some thoughts about what would make a difference. So ask them, because again, this is a situation where you're not really expected to have it all figured out. This is new for everybody. I mean, within the last 2 years, new for everybody. So go ahead and ask them, because it's a wonderful opportunity to partner with your patients and family and community and see what they have to suggest, because they can be very creative people. So that's our patient and family engagement play suggestion. The leadership play is to add some communication questions to your leader rounding. So many of you are already doing leader rounding or want to get back to doing leader rounding. These don't have to be permanent additions to your leader rounding questions, but you want to ask them for a period of time. It could be a week, or maybe it's a specific day of the week for a few weeks. However you want to structure it, you want to make it easy to implement, not burdensome, but you're trying to identify who your staff members are who are excellent communicators, and in a timely way, what has just gone on in the hospital, because that gives you the opportunity in real time to follow up and speak with the staff members, both in terms of who's done it really well and to identify what the barriers are or what the situations were that were impairing the effective communication. So in addition to going out more broadly to your community, you want to get this timely feedback. You're going to figure out who's already rounding regularly or who's about to start rounding, because that's something you're already doing, and decide which ones you're going to add for what time period. And then again, you're going to compile the results, use them internally, and then share them with VHHA, because statewide, we're going to be able to see some themes and also some creative suggestions, I'm sure, that are going to come back from your community. Obviously, when you're sharing that with VHHA, you're not going to give us a list of, your staff members necessarily who are doing that, just what they're doing and what information you're getting from your patients about what is really effective and what's being done, because we can't wait to see all the fabulous suggestions that are going to come in from your patients and from your team. These are some of the questions. Again, there's no magic to using these specific words. You can make up your own questions, but these are some of the concepts to consider in adding these questions. It is a good idea, though, whatever question or questions that you decide to use in rounding, have them be consistent from leader to leader that is doing the rounding in your organization, so you're at least getting some consistent feedback and understand the way in which you're asking the questions, so that the information that you gather will make sense when you combine it. In terms of staff engagement, remember what we heard from the membership was make it playful, not burdensome. So we have two very playful ways of approaching staff engagement around patient experience. What you want to do is figure out not only what not to say to patients and families, but also what not to say to each other. And your staff, if you go to them and say, okay, what do we say to each other that really erodes teamwork and interferes with effective communication and frustrates us? You will open a floodgate. I have done this with groups, and we could go for the whole rest of the time allotted, and people will just give their bullet points, and you capture them of, oh, you know, somebody said this, or we say this, or we do these things. So start them there, because that's really relevant to what frustrates them on a day-to-day basis. When these things happen, that makes for a frustrating day. So start them there about talking about how we impair with team communication when we say certain things. And from there, you can move to, what do we say to patients and families that we shouldn't say? By approaching this in a playful manner, you make it possible for people to actually admit that things aren't always ideal. And that's important, because often that conversation is hard to have. And when you say, look, we all do it wrong sometimes, or we've had situations or we've seen it done wrong, so let's just open up and talk about it and figure out a different way, that can be very effective. So again, things that come up, list of words and phrases you should never say to each other. It's not my job, it's not my patient, I'm at the end of my shift, and so on. These are some things that come up. Then once you've got that well established, ask to create a list. It's fun to do in staff meetings, of things we should not say to patients and families, like short-staffed, because that short-staffed, that phrase makes people think they should be concerned for their safety. There's other ways to say that are less alarming, but that's just an example of one of the things you might choose to say, okay, we're not going to say this. Once you've come up with this list, and again, it's a fun thing to do in a staff meeting, people will get on board. You could do this as a survey of your own staff, just a 1 or 2 question survey. What do we say that we shouldn't say? You know, give some examples. Discuss these phrases, and what you want to do from there is say, okay, when do we say these kinds of things, and then what could be said instead? So you can make a master list, and again, you see at the end of all of these, it's then share it with VHHA, so we can share it statewide. Video vignettes is a similar idea. People love bloopers, right? I mean, people enjoy watching bloopers reels of various things. So you can create communication bloopers videos. These are informal, say, 3 to 5 minute videos that your staff can do on their phones, you know, with each other, not with real patients, obviously, but showing things that are said that shouldn't be said. And then what do you say instead? Like, here's what we are on our worst day, and here's what we are on our best day. You could even create an internal video contest. People get really into making informal videos. And then you have this vast staff education library, because people have submitted these videos. There are opportunities for discussion, because again, 3 to 5 minute videos, or, you know, could be even shorter, but these are not long videos. These are just quick things, and you're engaging your staff, and you're opening up a discussion about, again, what works, what doesn't, you know, how does this all move forward? So those are fun things to do. Finally, you want to mine your data to identify your excellent communicators. So you're going to take a look at your surveys, leader rounding results, social media, whatever information you're getting where people are being named, and you're probably already recognizing them through some existing program. But if they're being named for communication, then you want to go shadow them, see what they do, how it works, and then interview them. Not only observe them, but then interview them for their tips, and then create that internal communication tip sheet. That can be incredibly valuable. Organizations have done this, for example, around quiet at night, because there were certain nurses that never got quiet complaints, and they followed them and found out what the tips were, and there was all kinds of valuable information that came out of that. So see what your own people are doing at the front line and who's doing an excellent job of it. So that's the overview of the playbook of the program. And does anyone have any? You have not really been using the chat or the questions, so I'm not sure whether we're going to get any, but we'll wait a second and see if we do. And if not, I'll tell you what our next steps are. So in the interest of time, I will go to our next steps. So in October, we are offering office hours with the VHHA team, so that if you would like some support in implementing any of the plays in the playbook, we are happy to have you set up some time, and we'll speak with you about that and provide any support that we can for that. In November and December, we'd like to have a follow-up webinar where we're going to share what organizations have been learning statewide, and presenting these compilations that we're developing and the new resources that will be generated as a result of this. And then in 2023, we will continue moving forward with some of the educational topics that you have suggested that we move forward with. So, and as I said, please do, if you have other topics that you would like VHHA to address and where you feel that statewide support would be helpful, please do let us know. So those are our next steps. And then I'm going to turn it back to Jennifer for any, or Abraham for any closing thoughts.
Yeah, so this is Jennifer. Thanks, Julianne and Carrie. This is great information, and I love the comment that you made that we're being mindful of the bandwidth of our teams, which is why using this data can help us focus on what the patients want and need. And getting staff excited and engaged, really is the key to the success. So just thank you for that. Again, if anybody has any thing for discussion, we can open the floor up. I didn't see anything in the chat. And if not, I'll just end with thanking everybody for joining our discussion this morning. And we really look forward to hearing how you are going to use these plays in the new playbook and sharing them at our next webinar, which will be scheduled late in the year. And then again, to share our statewide insights and experiences relating to this improving communication. We really think this can drive our success around patient experience in the state of Virginia.
So Jennifer, I will make one final comment for those that may not have been on at the beginning. We will be sending out a copy of the presentation slides, a copy of the playbook, and a recording of this event to everyone this afternoon. So we've gotten a couple of questions about that. So look for that in your inbox this afternoon. If you don't receive it by tomorrow, certainly reach out to us here at the VHHA. Thanks again, everyone.
Thank you.
Thank you.